Good morning, Mix. November is COPD Awareness Month, a devastating condition that affects millions of people and a condition that many can avoid.
Dr. Janice Coffin and student Dr. Madison James from Wellstar MCG Health join us this morning to tell us all about this disease and what you need to know. Thank you, ladies.
Good morning.
Yes,
Good morning.
Nice to have you. Student Dr. James, let's start with you. So we just mentioned November is COPD Awareness Month. What are some statistics you can tell us about the disease?
Yeah, thanks so much for having us. So 13 million U.S. adults are diagnosed with COPD, and 12 million U.S. adults have undiagnosed COPD. And 1.5 million emergency department visits are made annually for COPD, and 85 to 90% of all COPD deaths are caused from smoking. And COPD is the third leading cause of death in the United States.
Wow. Okay. So let's talk about the leading causes. You just had some of those on the statistics there. Leading causes of COPD. And also, what happens to the bronchioles or the lungs when you actually have this?
Yeah, so the leading causes of COPD are smoking, long-term exposure to irritants like secondhand smoke, air pollution, dust or workplace fumes, or biomass exposure like wood smoke. And another leading cause is a hereditary condition called alpha-1 antitrypsin deficiency. And the way that COPD affects your bronchioles in your lungs, so a normal bronchiole or an airway is open, allowing air to flow freely into your lungs, while in a COPD patient, their airways are thickened and narrow due to chronic inflammation, and they also produce excess mucus, which blocks the airflow from flowing into the lungs.
Doesn't sound fun at all. Let's talk about people at home that might be dealing with these underlying conditions. Dr. Coffin, what can we do to prevent this?
Yeah, so great question. So again, lots of millions of Americans are affected with chronic obstructive pulmonary disease and may not even know that they have it. And so right now is influenza season. So the things that we can do to protect ourselves, make sure that you get your flu vaccine. Again, if you are a smoker or if you're over the age of 65, get your pneumonia or your pneumococcal vaccine. Those are things that prevent you from getting infection from the flu or pneumonia. If you do smoke, try to talk to your primary care provider about smoking cessation and trying to stop smoke. Or if you have someone that smokes in this house, have them go outside so it doesn't get in your carpet and your curtains and those kind of things. Try to be as physically active as you can. Again, try to open up those airways. And again, trying to avoid using carpet, room deodorized things in the house that can cause chronic irritation of your lungs. You just want to kind of avoid those things that can trigger inflammation of the lungs.
So is there a proverbial light at the end of the tunnel? Is there a treatment that can be done for COPD?
Yeah, so another great question. So for chronic obstructive pulmonary disease, what you want to do is you want to talk to your primary care or a lung doctor about getting what's called a pulmonary function test. And that kind of measures what's called your forced expiratory volume and forced vital capacity. Depending on those numbers, they may want to go ahead and start what's called a bronchodilator, which is an inhaler that helps open up the airways. And as those airways become more inflamed, they may want to give you a steroid type inhaler. For some patients, there are certain medications or even oxygen that they may need if their pulse ox is lower than 90%. But again, getting those things that prevent. So if you're smoking, try to quit smoking. If you have a smoker in the house, have them go outside and smoke. And again, just getting those vaccines that protect you, because 'tis this season right now with a lot of flu, a lot of pneumonia. We're also getting COVID. So please protect yourself and talk to your primary care doctor about getting a pulmonary function test if you're having underlying lung problems.
Okay.
Good reminders right there. And Dr. Coffin, where can people go to find more information and learn more?
Yeah, so obviously we work at Wellstar MCG Health, so you can go to the wellstarmcghealth.org website. Again, constant that I go to is the Center for Disease Control, so cdc.gov. Lots of information, whether it be on chronic obstructive pulmonary disease, vaccines, or any of those other chronic illnesses that are out there. So please be safe. Again, people are going to travel for the holiday season, so just make sure you're protecting yourself, getting your vaccines, lots of hand washing, those kind of things.
That's right. Keep those hand washing going with everything that's going out there right now. Dr. Coffin, Dr. James, thanks so much for joining us. Appreciate it.
Thank you. Thank you.